A new survey is shedding light on some of the potential causes for vaccine hesitancy in the U.S. An op-ed in the New York Times titled "Meet the Four Kinds of People Holding Us Back from Full Vaccination" breaks down the survey and how to get more hesitant people vaccinated. Dr. Sema K. Sgaier wrote the piece, and she is the co-founder and CEO of Surgo Ventures, which conducted the survey, and an adjunct assistant professor of global health at Harvard T.H. Chan School of Public Health, and joins us now. Thank you so much for joining us. So this is very interesting. The overall majority of the people in this country are willing and ready to take the vaccine, to receive the vaccine. But what this article looks at is that smaller group of people that haven't done it, that aren't that enthusiastic, and then you break that group into subcategories to find out why. So can you give us an overview of the types of people who are not getting the vaccine?
Thank you for having me. Absolutely. So there are four different types of people that remain that have not taken the vaccine. And these have real barriers. I mean, some of them are beliefs and some of them are actually access barriers. So let me just walk you through those four groups. The first group is what we call the watchful. This group is actually enthusiastic to getting the vaccine, but they want to see many others around them, family and friends, get the vaccine first. The second group is what we call the cost anxious. These people believe that getting the COVID vaccine is actually going to cost them time and money, despite the fact that the vaccine, as we know, is free. But they have true barriers in terms of time and cost. A third group is what we call system distrusters. System distrusters believe that people of their own race are actually treated unfairly by the healthcare system, as well as have other barriers such as side effects. And then finally, we have this group called the COVID skeptics. COVID skeptics are generally skeptical about COVID, but they're also skeptical about the vaccine, and they actually believe in at least one conspiracy theory when it comes to COVID and the COVID vaccine.
Okay, so let's take a look at that group, the skeptics. Even though, I mean, it's 14%, so the rest of them kind of make up a larger percentage of the people who aren't getting the vaccine than skeptics. But let's look at this 14%. You guys found that 84% of COVID skeptics believe that the government is using COVID-19 to control people. Can you explain where that comes from and what their belief is?
Sure. I mean, we actually, one thing I want to say about the COVID skeptics is while the other three groups have actually shrunk over time in terms of their size, this group has remained pretty stable. So it is a pretty entrenched group. And these believe in several conspiracy theories, as the one that you told us. Now, the question is, how and why do they believe in these conspiracy theories? I mean, one of the things that we find is that during a public health crisis in general, there is a lot of misinformation being spread. And in general, there is distrust in science and health, in society. But what we find is that social media is playing a big role. Facebook, Twitter, YouTube, and people in this group actually spend a lot of time on social media, and their main source of news is social media. And as well as, there are trusted figures, political as well as non-political, that these people, follow and believe that have also played a big role in spreading a lot of this misinformation.
I guess, in a way, it's sort of not surprising that some of these other categories have shrunk, because if you're part of the watchful, well, now you've had several months to watch and see how, people respond to the vaccine. Maybe you need more time. Maybe you're interested in sort of the long-term implications, but the short-term implications you can kind of see. If you're averse to the cost, you're concerned you're going to be sick and have to take time off work. If you have an employer who gives you a day off, paid day off to go get the vaccine, then, that problem is solved. So for your review, if you don't trust the system, maybe you would take a watch and see approach as well. I don't know. I'm not sure about the system distrusters, because, sometimes, hey, if you distrust the system, you might have reason to distrust the system. We've certainly seen, statistics and numbers that indicate that there are biases within the healthcare system. And I mean, just look at the way COVID has impacted minority communities, Black and Hispanic communities, and you could say, yeah, there's a bias within the system. The different categories of people, though, they aren't necessarily confined to certain areas of the country. What were the most surprising trends that you found?
Absolutely. So a couple of trends. One is that, these groups, each of these four categories have members of different race, ethnicity, as well as political affiliation groups. So it is not that, system distrusters are only community of colors. There are a wide range of communities, while communities of colors overrepresent them. Similarly to the COVID skeptics, while we see a higher proportion perhaps of Republicans as well as Democrats, we also see a lot of independents, Republicans and white people. We also see quite a few of independents and Democrats. So I think one key surprising result, and this is the reason why we took this approach, is that people of different demographic groups actually fall across all of these different personas. The other surprising result is that we found that the distribution of these groups to actually vary considerably across the United States, as the map here is showing. For example, when we look at COVID skeptics, in a state like Arkansas, 30% of adults are skeptics. In Nevada, 29% of adults are skeptics. In Wyoming, 25%, whereas the national average is only 14% of COVID skeptics. So you can see how the skeptics are overrepresented in different states. We see the same thing for the other three groups. So just give you one example, if we look at system distrusters, we see a larger than the national average proportion in places like Washington, D.C., Maryland, Georgia, Michigan, and Louisiana.
So, the purpose of asking these questions is to ultimately figure out a way to, win these people over. So what steps can government leaders take to persuade people that the vaccine is safe and it's the right thing to do?
Absolutely. I think the fundamental thing we need to start with is really understanding why people are hesitant, or why they're not taking the vaccine. There may be true, real barriers, like we said, cost, time, access, for example, in the cost-anxious group. So I think what's really important for government to do is understand these barriers and come up with solutions. The other thing I will say is that solutions at the end of the day need to be local. They need to be community driven. So for example, if we look at system distrusters, we need to really engage the local community leaders, churches, barbershops, other nonprofits, whatever it may be, that communities in those places truly trust and have a conversation with. When it comes to COVID skeptics, we need to really engage the leaders, that they truly trust the information from. So I think really the key message here is that we cannot take a one-size-all approach. We can't just say the vaccine is safe and take the vaccine that's available. We really, truly have to meet people, where they are and address their concerns, because these are real and valid concerns.
I think that is sort of the best message to leave people on. I think, initially there was this idea, or sometimes there's a tendency to kind of dismiss people who are not interested in the vaccine as, not well educated or not paying attention. And the reality of it is these are, often bright people, hardworking people, good taxpayers, good parents. They want the best for themselves and their family. And so keeping that in mind, speak to them that way and tell them the information that they need to know. It's a really fascinating article. Dr. Sema K. Sgaier, thank you so much.
Thank you for having me.